Recently, we've been implementing ERAS protocol, which stands for Enhanced Recovery After Surgery. And this is just to kind of like help the patient have a better recovery and allow for shorter hospital stays. So there are certain things we can do before the surgery, after the surgery, and during the surgery that will increase the patient's chances of having a quicker and easier recovery. We also give Gatorade beforehand. They call it carb loading before surgery, and that allows the patient to have less chance of nausea and vomiting after the procedure, and it also helps keep blood pressure kind of normal during the procedure because they don't come in super dehydrated and kind of tired and weak from no fluids and no food. They've noticed that the carb loading really helps before surgery. ERAS protocol is great in the orthopedic patients, and it's also great with patients that have cancer. They're already at an increased risk for postoperative nausea and vomiting, so anything we can kind of do to increase their chances of having a nice recovery, we try to do that. We also use other types of drugs like ketamine. Ketamine is a very nice drug. It actually lowers your requirement for pain medication when you give it during surgery. And instead of doing a general anesthesia with gases, we like to use things like propofol, which is an IV drug. It goes through your IV, and it actually will prevent or help lessen postoperative nausea and vomiting. So, and then there's also other things like we can do regional anesthesia, such as tap blocks, peripheral nerve blocks. We can do spinal anesthesia, epidural anesthesia. So we have a whole toolbox that we should absolutely be implementing to help make the patient comfortable, have a nice recovery after anesthesia and surgery, so they're able to get on with their life, and have a nice recovery.